Hello and welcome to the Centre for Creative Health's In Conversation series. This series highlights members of the community who assist CCH in presenting our arts and health programs and allows us to focus on some of the incredible work that these professionals do. My name is Steph Cibich and today we're speaking with the artist Lee Walter. Hi Lee.
Hello.
So we'll just jump straight into it. How would you best describe your practice?
It's a bit difficult to describe, I think. I suppose with my photography, I would say I'm quite measured and very particular with how I create my work. I like to be very concept-based, so everything that I put in my work definitely has something to do with the concept, from like the smallest little petal is always put there for a reason, and then when I do more painterly stuff, I'm a little bit more messy, I guess.
Yes.
I like to experiment a bit more, but I am more photography based, so definitely a lot more measured.
Yeah, great. And did you always want to be an artist, or how did you get started as an artist?
I always wanted to be an artist, except for obviously when you're a child, and I think I wanted to be a figure skater for a while. I used to do figure skating when I was little. But yeah, it wasn't meant to be.
It's fine.
I was always drawing, always messing around with charcoal and paints and everything. All my school journals always had pictures always drawn on the inside of it. So it was always a natural progression for me, I think. Although when I was in year 12, it was definitely the conversation with my mum and my family. It was like, oh, try to do something that you'll fall back on, rather than, the arts career. So I actually ended up following my mum's path, who is a nurse, and went and did nursing. And I was a nurse for 12 years. And once I'd had my fallback, I then decided to go to art school. And now I'm not nursing anymore. So it's kind of gone full circle.
That's so interesting.
Yeah.
And probably relates to a lot of creatives in the sense that they may feel that they have that pressure to maybe have like a real job or a fallback, like you say. But And so 12 years, what sort of a nurse were you?
I did mental health, so mental health and drug and alcohol, so working with patients who suffered with depression, anxiety, schizophrenia, bipolar, alcohol addiction, drug addictions. It was definitely an eye-opener from when I first started, and it definitely made me more of a resilient person, I think. And it's definitely informed my art practice. I think it's made a huge difference being able to have that background and life experience and then going on and studying, compared to the work that I might have created when I first left school. If I'd gone straight into art school, I don't think my work would have been as informed as it is now.
Yeah, wow. And having, like you said, that life experience and that professional experience, and wow. And
probably full of more angst.
Sure. Yeah, sure. Of course. And I mean, now your practice primarily works with photography and also installation, and it does tend to explore themes surrounding the human condition and ecological environments. What led you to want to investigate these ideas? Was that partly because of your experience as a mental health nurse, or something?
Not really, but I think it's definitely informed my idea to question the human condition. I'm very passionate about the environment. I think it's very important, and I think I'm interested in how we live in the environment and how the environment around us affects us, and then we in turn affect the environment. And I'm trying to create work that kind of has a dialogue between these two things. I think I want to create a positive outcome from those dialogues and try to just for me, I just want to get to understand how we live in the environment and try to be more positive within it.
Yeah, no, that's I think that that's probably something we can all relate to on some level, for sure. And it's such an interesting area to want to investigate. How then do you feel exploring those ideas within healthcare facilities?
I think art in health is so important. I think it makes a huge difference to people's mental health, especially with my nursing background. I think I am doing a project, the dialysis project at the moment, which is looking at how art and diversional therapy can affect people who are on dialysis. And I think it's really important to people's mental health. I mean, the people who are having dialysis, they're sitting there for between 3 to 5 hours a day for 3 days a week, and they're quite limited to what they can do. So just in that respect, their mental health is affected by sitting there in that chair. You know, they're not able to travel and do the things that they would have wanted to have done before having to have dialysis. So I think being able to facilitate some sort of diversion within art can make a huge difference to people. Sure. Even art, music therapy makes a huge difference. We were lucky enough to get somebody to come in and do a day session with some music therapy, and the patients they loved it. They thought it was really, really beautiful.
That's great.
So it definitely changes their mental health, even if it's only for a short period of time.
Yeah, of course.
But there is definitely a need for it, I think.
Yeah, I think you're right. And it has that huge impact, doesn't it? That ripple effect. In 2019, last year, you undertook a SALA residency with us at the Centre for Creative Health at the Royal Adelaide Hospital. And the outcome of that residency were some really insightful and poignant works. Could you maybe talk a little bit about that residency and what it involved?
Yeah, so that was actually the first year that I had decided to quit nursing as a
full-time
job. Yeah.
I had no idea it was so recent. Wow.
Yeah. So I went, I was on maternity leave and I was supposed to go back. I think my first shift was supposed to be Christmas Eve in 2018, coming into 2019. And I was just like, I don't think I want to go back. I want to be able to explore my art practice more. So I'm lucky I have a supportive partner who said, just do it. Let's see how it goes. And because I made that decision, I was then able to go for this residency, and I was lucky enough to get it. And the fact that it was working in arts in health, it was like it was meant to be. It was a perfect fit. So I went into the RA and I actually sat with patients who had been diagnosed with dementia. I brought in different objects such as natural elements like shells and rocks and crystals and scent jars, so with mint and coffee, and some of the objects that I brought in sparked conversations and memories, and it was just really about just informally chatting with these patients and finding out about their life, their memories, and then creating work in response to that. I feel like the works, I've got them around the room now actually.
Perfect.
I'm just looking at them, yeah.
Couldn't have planned that question better.
I feel that although they're still lives, they're more of a portrait of that person's memories and the time that I spent with them. I feel that a portrait of a person is more than their face. I think it's more about their experiences that make them who they are. Yeah. And I wanted to capture that in the work.
Yeah, I think you did. And they're so beautiful. And you received a SALA prize for that body of work too, didn't you?
Yes, I did. I got the Atkins Photography Award, so that was pretty special.
Very special, brilliant, well done, and so well deserved. Going back a little bit now, you were speaking about the Hampstead Dialysis Art Project before. So are you able to perhaps speak in more about that in terms of maybe how long that's sort of going for, or what's involved in the project?
So at the moment it's postponed just due to the COVID-19, and they're such a vulnerable community that it's better to wait until it's a little bit safer to go back in there. But it was going for 10 weeks last year, and we were planning on doing another 10 or so weeks this year. We started and then we stopped. And it's myself and another creative, Darlene, who does arts creative writing, and she's also got a background in research, and we're pretty much going in, we're implementing different art activities and diversional activities with each patient and trying to see if we can make the time go a little bit quicker. And a lot of the patients are responding to it and really enjoying it. We've had patients do acrylic painting, we've had them do watercolour painting, we've done puzzles with them, we've played bingo with them.
Oh, great.
We've done some creative poetry. It's been a really interesting experience, challenging because they're very limited, they can only use one hand. So we've got to think of different art projects that we can do with patients that can only use one hand. So I've been at home experimenting, trying to do things with one hand to see how it goes. And if they need help, obviously we're there and we do it with them, but we try to want to make it something that they're able to do with as little assistance from us, so that they get more of that creative input. That's great.
Yeah. I guess moving on a little bit as well, this year with the bushfires and of course COVID-19, we've had a pretty intense start to the year. While these events have been really devastating for many people, they've also been great in the sense that they've inspired generosity and this desire to sort of provide hope to our community. I was wondering if you could maybe talk about something inspiring or uplifting that you've seen this year so far.
Oh, it's amazing to see what people can do when we're faced with such tragedy and such harsh, difficult circumstances. It actually is quite inspiring to see, just from the littlest things, that when you get the note in your letterbox saying that if you need something picked up from the shop, that there's somebody in the community that will do that with you, or knowing that there are people out there that are willing to help. But I did really like, I think it was in Italy, when I saw a video of people out on their balconies and they were all joining in song, and it was just so beautiful. It
think I saw that.
That's just great. Knowing that people striving for this connection, and trying to get it any way they can, and knowing that there is somebody else out there. I don't know, it just made me all warm and fuzzy.
Yeah, no, I totally know what you mean. And I think I might have seen the video or a similar one. I think there's a few floating around, but there was one with some police officers that drove into the middle of the street, and they got out of their car and they just started playing music, and everyone's on their balconies and dancing and singing, and just kind of, it wasn't, I don't think it was something that was planned. It was something that was sort of just like the police, I guess, kind of had it within their capacity to do this thing, and they wanted to cheer up the community, and it obviously worked a treat. And somebody captured it on video, of course, and it's on social media. But those sorts of stories are really inspiring, and it's you're right, like it sort of speaks to this. I guess this idea of resilience and strength within us, and that we're all in it together, I suppose. They're beautiful. Do you think that maybe in light of that the role of arts in health has changed in light of these recent events?
I'm hoping people consider it to be more important.
Yeah.
I honestly think it's one of the most important things, because I think the spirit and mental health can be changed so much by creative outlets.
Yeah,
we're all in this isolation together. Just turning on the telly and watching Netflix. That movie was made. It was considered. From the costumes to to the direction of the way that it's been planned, to just picking up a book and reading a book. That's a piece of artwork. The art is in every aspect of our life, and
so true.
It's very important. And I think also even if you don't have any kind of art experience, just picking up a pen or just doodling, it can actually be quite meditative, I think.
Yeah, I agree. And you're right. And there's a lot of people who maybe, you know, the sorts of people that might say, oh, I'm not very artistic, or I'm not very creative, but art is in so many other things, like you said, Netflix or the book, or, you know, even just listening to the radio, and it's more important now than ever, I think. Yeah, spot on. What about yourself?
Well, sorry, I was just going to say knitting. I can't knit to save my life, but you've got, you know, I know that my mum likes knitting, and, you know, that's her creative outlet. And, you know, just, you know, it's art's in everything. So, yeah,
very true.
You can find it in anything. Just look for it.
And great time of year to start knitting as well, if you're able to, to knit a scarf or a beanie or something.
Yeah.
I can't knit, I'm terrible. But I was going to say, what about yourself? How are you keeping creative in isolation? You mentioned that you've been experimenting with one-handed type activities, but is there something else that you've been doing or working on?
Lots of watercolour, so I quite like to paint, so I've been doing lots of watercolour. I've got a couple of commissions that of the native Australian flowers, so I'm kind of in the process of doing that. But mostly I've got two little kids. I've got a 4-year-old and a 2-year-old, so a lot of my creativity is taken up by doing stuff with them. So we've made like a little kind of diorama thing of the moon and the moon phases and painted that. Of course, they're interested for about 10 minutes and then they go off and I'm left to paint all the phases of the moon. And we created a little mini installation under the table. So we had streamers under the table and we had a little light going on. Just
that's so great.
Polymer clay. We got polymer clay out for the first time and made little monsters and
wow, that's really cool.
Yeah,
and that'll keep you busy, I'm sure. Just my last question. Could you maybe speak briefly about the work of any other artists or something in the community groups perhaps who are doing positive work at the moment? Is there anything that you would like to speak to in relation to that?
So not really a community group, but it's getting the community involved. I follow on Instagram, I think it's the Met Museum, and they're actually doing a thing called Met Twinning, where they're encouraging people to look at an artwork that they have in their collection and they get them to mimic it. So people are creating these artworks out of other artworks and they're hilarious. It's just
that's great. I might see if we can find that on social media and maybe share that with our viewers. That'd be great. I think I've seen
and there is one more. Sorry,
I just said I think I've seen the same thing. They're awesome.
Okay. Yeah. There is also one more, and that's the I listen to the Corona cast every night before I go to bed. It's a bit it's my like little nerdy thing that I do every night. I think it's really interesting. But Dr. Norman Swan, who does the Corona cast, he's started a thing called I think it's called Together in Art with Kids, and it's encouraging artists with the I think it's the Museum of New South Wales to create work to a theme. So getting children to be connected through that way in isolation. So that's something that's really interesting. So I think the artist that they had on was Catherine Barton. So she created a theme, and then children made artworks in response to the theme that she set. And I think they've got another person at the moment. I'm not sure who. But that's really interesting. I think that sounds really great. Good.
And all these sorts of ideas that are coming out of the woodwork, and whether it's on social media or on TV or podcasts, or it's really great to see. There's quite a bit out now, but everyone's sort of banding together and trying to give ideas and just supporting each other. I think it's great, really inspiring.
Yeah, it is.
Well, thank you, Leah, and everyone else for joining us today. If you have any questions or if you're looking for further information about the Centre for Creative Health or any of our programs, or of course our In Conversation series, please check out our social media programs and our website. But that's all from us for now. So again, thank you, Lee. Thanks for joining us, and bye from us. See ya.